Hello everyone, and welcome to a very special edition of Beacon Buzz. Now, of course, we don't really have a lot of events going on to talk about, and that is for a very important reason, because of the COVID-19 coronavirus outbreak that we are dealing with. So we thought we would bring you a very special program today where we get to hear from some professionals in the field. Now, before we kick it off, of course, we want to thank our sponsor for today's episode, that is Bluegrass Community Federal Credit Union. Thank you to them. So let's just get it started. I have two amazing guests from the Ashland Boyd County Health Department. We have Matt Anderson and Erin, Crace, and I'll let them introduce themselves to you. So let's hear from you guys.
I'm Matt Anderson, Emergency Preparedness Coordinator at the Ashland Boyd County Health Department.
Erin Crace, I'm the Ashland Boyd County Health Department Nursing Supervisor and Reportable Disease Nurse, and also the Public Information Officer.
So first off, COVID-19 and coronavirus is all over the news. It's all over social media. So what can you guys tell us about COVID-19, the coronavirus? We know it's an illness, maybe what some of the symptoms are that people can look for, and what they should do if they feel like they're exhibiting any of those symptoms.
So the novel coronavirus, or COVID-19, is a virus that wasn't around until recently, possibly the end of December of 2019, originated in mainland China, specifically focused on the Hubei province, and then it has spread nationally, internationally since that time. Symptoms, most predominantly, are fever, cough, shortness of breath, and if you are experiencing symptoms, or if you've been around someone who has been diagnosed with the case, if your symptoms would normally be able to be treated at home, you can treat your fever with over-the-counter medications, and then you can treat your symptoms with just over-the-counter, and you're not experiencing a medical emergency. What we require you to do, or what we encourage you to do, is to actually stay at home, treat those symptoms. If you are concerned about something medically that you are having, call ahead to your physician. We do stress the importance of calling ahead to your physician if you do need medical attention. If you are experiencing a medical emergency, something like shortness of breath or difficulty breathing, that is times whenever you would go to the ER.
All right, well, Erin, thank you so much for that great information of just letting us know what COVID-19, the novel coronavirus, is. Now, it's all over it's like we said, it consumes the national news. The President of the United States' briefings, the governors of our tri-state area here, all three states, do briefings and have set up websites. Matt, let's go to you. What can you tell us about how the Ashland Boyd County Health Department is responding to this situation?
Well, every day for at least the last 2 weeks, we've had multiple meetings. It really consumes every second of every day for most of us there. We have a daily briefing. It could last anywhere from an hour to 2 hours about the latest governor's report, preparations for possibly drive-through testing, coordination with law enforcement, coordination with our regional preparedness coordinators, emergency management. So we are in contact with those people throughout the course of the day, every day, whether it's through video conference, phone calls, texting, meeting. I know myself and our director, Maria, were at the Emergency Operations Center in Westwood yesterday. Both of us were there at different times talking to Tim England about the delivery of supplies, masks and gowns that we would be able to disperse to King's Daughters, other community partners, so that everybody's prepared and able to protect themselves should we have a case here in Boyd County. So it's really our main focus, our number one priority. We spent lots of time developing strategies, plans, mapping out things for, as we progress through this, being able to handle it and keep the public safe.
All right, well, that is such great information about what is happening here at the local level. Now, I know I mentioned earlier how it's all over the news and it's all over social media. What are just some good, reputable sources, maybe websites where people could go to get information on this?
So going to reputable sources is very important, Emily, and you want to make sure you're going to sites like cdc.gov. There's also, Kentucky has a phenomenal site that has a lot of information about state-specific testing, and that website is kycovid19.ky.gov. And then there's also links to the CDC on that website as well. And then the health department has a website, abchdkentucky.com, and we have links to the Kentucky site as well as information on our Facebook page. And Matt can probably talk about that a little bit more.
You can check out our Facebook page or our website. Update those personally throughout the course of the day. So if there's any new information, especially locally pertinent information, it will be on there. It's trustworthy. It is verified. It is not rumor driven. It is not something that you hear from your brother or a friend that works at King Sodders that heard from some person. You can trust it. It's absolutely rock solid. So that's where we want people to go to find out information and not spread rumors that get people all up in arms for no reason.
Well, that is such great information about where people can go to find solid, credible details, facts, statistics. So what can we do? What, as just, a normal person living your life in our area, what are some practical steps that, we can take to prevent the spread of this disease, to prevent, getting it? What kind of tips do you have for us?
So, Emily, that's a great question. And so it is, we all want to be able to go about our lives, but our lives are different, and we do have to make sacrifices and make changes. Some of the things that you can do to protect yourself, obviously washing your hands is very, very important. Covering your cough, covering your sneeze. If you're able to cough into a tissue, throw that tissue away, wash your hands. And then something that we're practicing here today is the social distancing. That is so very important, that we really all need to focus on. Like Matt as a person, still I'm 6 feet away from him because we're in this room and we're trying to give information, but you don't want to put those individuals at risk. So it's about practicing that social distancing as much as possible whenever you can.
And I think it's important too that we all want our lives to return to normal as they were a month ago or 2 months ago or 6 months ago. And the quicker that we all adhere to the advice of the medical professionals, the quicker it will return to normal. Ignoring it, wishing it's going to go away, thinking I'm just going to go do it, I'm 30 years old and I'll be fine, I'm not going to get it, it doesn't affect my age group, that's not what it's about. We all have to be on the same team, and the quicker we do that, the quicker this is over for everyone and life returns to normal, the economy returns to normal, and this goes away.
Well, thank you so much for those tips, and thank you, Erin, for pointing out the social distancing. We probably should have explained why we're sitting kind of funny across the table from each other, but we did want to make sure that we are following the advice that we're giving to everybody. Now, we did put out a call for people through our Facebook page to send us some questions, and we did get some questions inboxed to us. So I'm going to ask some of the questions that we got. These are just, people in the community having some things that they wanted to ask of the health department. So the first one is somebody asked that says, my children attend private horse riding lessons. It is them, 2 kids, the horse, and the instructor. I'm trying to keep a routine, but I also don't want to be the family finding the exceptions. Should they continue attending or should they cancel?
So I would say to that individual that unfortunately we're all having to make sacrifices to our daily lives. So I feel like you want to limit the interaction and social interaction that you're having with individuals in a close contact. So I would say you probably would be best if you canceled those horse riding lessons. Obviously, as a parent, you're going to have to look at finding alternatives. Something good may be to get out and take a walk as a family. You can visit local parks if those are open. Obviously, you just want to avoid crowds and practice that 6-foot social distancing outside of your family.
We have another question, which seems really relevant. I've seen a lot of posts about, being outdoors, not going stir crazy. Someone sent us a question that says hiking trails. Should these be avoided, for example, some of our local state parks, local parks?
As long as you maintain social distancing, except for family members, outdoor activities we believe are fine. I know I take walks with my family in the evening around my neighborhood. We don't come into contact with anyone else, so it's important to be able to be outside if you can, but remember all of the other tips that you hear about hand washing, social distancing, and avoiding large crowds. And those are the things that are recommended to keep everyone safe. Not only you safe, but people you come in contact, because one of the trickiest things about this virus is that there are people who are asymptomatic, who may have it, and can pass it to other people completely without any knowledge, and that is why this has become such a problem.
Even though the school cancellations have hit, we are in spring break season. So we did get a question from a viewer asking about, they had a beach vacation planned in the beginning of April to go visit grandparents. The grandparents would be a susceptible population. With a total, our family would have 8. We aren't going to tourist attractions because they're closed, but we would be visiting with each other, sitting out on the beach a lot. We're thinking about canceling, but don't want to make the kids and grandparents sad. Should we cancel, or should we wait a couple of weeks and see?
I think that unfortunately, a beach trip is just not a priority right now. I think that you're probably going to have to come up with an alternative, something that you can do more locally. I think that you also want to consider something that Matt already touched on, was just that it's about protecting yourself as well as others that you're around. So obviously you don't want to make the grandparents possibly ill. And in this time, I think that travel is best to just avoid completely.
And I think that at any given time, whether you're on a beach or wherever you may be, you don't know the people around you and where they have come from. They could have come from California, they could have come from somewhere from a county that has several positive cases. So you don't know who's going to be next to you. You will come into contact with people, whether it's at a restaurant or through a doorknob or anything that those heavily touched surfaces. So you may just say that we think we're going to be on a beach, it'll just be us. It's not just you. There's going to be lots of people around. It's unavoidable in some situations. So just take proper precaution, and this is not the year for the beach trip.
All right, thank you so much for all of this great information. We really appreciate you two being here with us today. We are going to, just for our viewers here, we're going to put some contact information for the Ashland Boyd County Health Department in the post with this video. So thank you so much for being with us today. We just appreciate all of this information so much. You guys are really doing great work and a great service. As always, feel free to like and share our videos as you all view them out in the public. And everybody, just wash your hands, stay safe, practice your social distancing. We will see you here on Beacon Buzz another day.